Assalamualaikum. For today's video, we will explain about anti-infective drug. Anti-infective works by agent of clinical usefulness for systematic administration act by inhibition of enzymatic processes important in the metabolic scheme of the pathogenic organism. Micro, we talk about 5 anti-infective drugs, which is penicillin, ciprofloxacin, aciclovir, fluconazole, and mebendazole. In short, penicillin is group of antibiotic medication, ciprofloxacin is group of antibacterial medication, aciclovir is group of antiviral medication, fluconazole is a group of antifungal medication, and last, mebendazole is group of anthelmintics medicine. So I will pass to my friend for explaining more about this medicine.
Hi everyone, thanks for joining the study group today. Let's start discussing our research on different anti-infective drugs. I will go first. I looked into penicillin, which is one of the earliest antibiotics. Penicillin is a group of antibiotics that are used to treat bacterial infection. It was the first antibiotic discovered and is considered one of the most important medical breakthroughs in history. The discovery of penicillin revolutionized the treatment of bacterial infection and significantly improved the outcomes for patients suffering from various infectious diseases. Penicillin is derived from the penicillium fungi and works by inhibiting the growth of bacteria. It targets the cell walls of bacteria, interfering with their ability to build and maintain the protective outer layer of their cells. This weakens the bacteria, making it easier for the body's immune system to fight off the infection. Over time, various types of penicillin and related antibiotics have been developed to combat different types of bacteria and to address antibiotic resistance. These antibiotics have been instrumental in treating a wide range of infections, from minor skin infection to life-threatening conditions like pneumonia and sepsis.
Wow, that is interesting, Syafiqah. I focus on aciclovir. Aciclovir is an antiviral medication that is used to treat infection caused by certain viruses, including herpes simplex virus and varicella zoster virus. It is commonly used to treat conditions such as genital herpes, cold sore, and shingles. Aciclovir works by inhibiting the replication of the virus, thereby helping to control and reduce the severity of the viral infection. It can be available in various forms, including oral tablets, topical cream, and intravenous formulation for more severe infection.
Great, earlier, I researched about ciprofloxacin. Ciprofloxacin, which is an antibiotic used for bacterial infections, is particularly useful for urinary tract and respiratory infections. It is commonly prescribed to treat urinary tract infections, respiratory tract infection, skin and soft tissue infection, bone and joint infection, as well as certain types of gastrointestinal infections. Ciprofloxacin can be administered in various forms, including oral tablets, intravenous injection, and ophthalmic and otic air solution. It is important to note that antibiotics like ciprofloxacin should be used only as prescribed by a healthcare professional, as inappropriate use can lead to the development of antibiotic resistance.
Nice work, Balqis. I looked into fluconazole. Fluconazole is an antifungal medication used to treat a variety of fungal infections, including those caused by Candida species. It can be used to treat infection in various parts of the body, such as the mouth, throat, esophagus, lungs, and genital areas. Fluconazole works by inhibiting the growth of the fungal cell and disrupting their cell membranes.
Thanks, Aline. I will study mebendazole. Mebendazole is an antibiotic medication used to treat infection caused by various parasitic worms, such as pinworms, roundworms, and hookworms. It works by disrupting the parasite's ability to absorb nutrients, leading to their eventual death and elimination from the body. Mebendazole is often used to treat intestinal worm infestation in both adults and children.
Awesome contribution, everyone. It's See 19 how these drugs target different types of infection. Does anyone have questions or thoughts about the drugs we discussed?
I'm curious if anyone found any common side effects among this drug.
Good question, Alia. I think some side effects might include gastrointestinal issues, allergic reactions, and potential interaction with other medications.
Speaking of interaction, it's important for patients to inform their healthcare providers about any other medication they are taking.
Absolutely, Aline. And considering the rise of antibiotic resistance, it's crucial for healthcare professionals to prescribe these drugs responsibly.
Well said, ANYSSA. We have covered a lot of ground here. Thanks everyone for your valuable contribution.
So, why are anti-infectives so important? Anti-infectives have revolutionized healthcare and are now critical in curing and even helping to prevent many kinds of infection. Thanks to anti-infectives, we can treat minor infection and most often cure many serious infectious diseases like pneumonia or tuberculosis. Also, can perform routine procedures and complete surgery such as caesarean section or joint replacement, which carry a risk of serious infection. Lastly, it gives vital immunosuppressive treatment like chemotherapy to people with cancer. Alarmingly, many anti-infectives are losing their effectiveness due to antimicrobial resistance.